Hi, my demonstration is going to be on one of the procedures that we do at my office currently. This is one of our very common procedures that we do, and it's known as a cystoscopy procedure. The cystoscopy procedure only takes about 5 minutes once we have the surgeon come in from start to finish. It can vary depending on the different surveillance or different diagnosis that the patient has, if it is going to be longer than 5 minutes. Most of the time, our patients are on surveillance monitoring, which means that if patients have bladder cancer, they will actually come in a regimen of every 3 months, 6 months, year, 5 years, however, depending on how well their bladder's working, as well as if their cancer hasn't came back or not. So with that being said, that is one major, or main, I should say, diagnosis that we do cystoscopies for. The other ones that we do is for overactive bladder, which means that you're urinating all the time. The others are blood in your urine, just painful urination. We sometimes can relate that to urinary tract infections, as well as incontinence. So I'm going to show you one of, I think there's 4 different scopes that are different, yes, 4 different scopes that our practice uses. But this is the most recent one that we started bringing and introducing to our clinic. It is actually one of my favorite scopes. One, because it is less contaminating to, clean and so forth, because it is a disposable, versus the ones we have to clean them ourselves here in the office, and then we also send them out to sterilization, as well as that is flexible. When I was trained, first started, it was something that was metal and it was stick straight. It would not move at all, go into the urethra. This one is an Ambu scope. Actually says Ambu on it. So again, this scope is all disposable. It is actually called a flex scope. I'll show you here why. It flexes all the way. It is very, very flexible, not fragile at all. It comes in a package like so. And the supplies that we will need for this procedure, again, is going to be sterile gloves, IV administration set of lines, and sterile water. So what I usually like to do is I like to go ahead and lightly open this bag. I'm going to put this in here so you know how I set it up. So it would be in a bag, closed up. I would open that bag, and I would have sterile gloves on when I do so. Once I have this open, I will have sterile gloves on. I will pull that line out, okay? Because it's all sterile inside, but I need just that line as of right now. There is a circle holder so you can hook to the stand. So I will hook it to the stand. I will go ahead, it has an arrow facing on our plug-in that will go to our monitor. So I will plug this into our monitor. And it demonstrates that for you on the monitor as well. I don't think it's as clear as it would have been if you were actually seeing it in person. When I automatically connect that line to our monitor, that goes ahead and brings up our camera. So this is what our patients and our providers will be able to see during their procedure at all times, okay? We will have our line and we will have our water hung up. And when the surgeon comes in, we will go ahead and hand him over the sterile water line. And that line actually prime prior to giving that to the surgeon. And due to that is I don't want air going directly into that bladder when we first insert that scope. So we go ahead and prime that water line. And when I mean prime, this is what we'll do. I will have the bag of water, take our IV line, turn it upside down, and twist this, puncture the IV line with the IV line and the water. And they have caps over there, so you take the caps off, connect the two, put it over a trash can, over a sink, prime it, hang it up, still staying, clean, so you don't put it, you just hang it over, hang it up, and that is primed. So that is your cystoscopy procedure. Thank you.